Hey guys, this is Dr. Langdon, board certified pediatrician, mom of 6 and grandmother of 3, with today's topic, which is prolonged use of the baby bottle. And it's a problem. Let me tell you why. For some reason, recently, I have had multiple different families with children who were still on a baby bottle well past the deadline to stop it. Our recommendation is to completely finish with a bottle by 12 months or the baby's very first birthday. Afterwards, all liquids should be placed in a sippy cup. It can be a straw. There are multiple different kinds of sippy cups. If you're very brave, you can even start practicing with an open cup with, of course, a lot of help and supervision at that age, but they should not be on a regular baby bottle. Now, I have, for some reason, like I said, recently run into several families. The babies maybe were 18 months, 2.5 even. I had a 3-year-old. Guys, this is not okay, and there are multiple reasons. The primary one is that we are worried about the baby, especially if the baby is being placed into the crib with the bottle in its mouth, because that sugary milk is pooling around its teeth. The carbohydrate in milk is lactose, and like any carbohydrate, it encourages bacterial growth, and that bacteria can lower the pH and damage the enamel of the surface and cause cavities in these babies. So we used to call it baby bottle tooth decay, and you still can. Some people call it bottle rot. That's pretty terrible sounding. And some people call it infant caries or early childhood caries, ECC. So whichever thing you want to call it, it means that this persistent and chronic and constant exposure to sugar is breaking down the enamel, lowering the pH, increasing the risk for holes or decay in that tooth. And this is very significant. The children need their teeth to chew, to develop normal language skills, and all of those things. And these families that we've been talking to recently, for some reason, just say, well, I have to do it because he won't fall asleep or she won't fall asleep without the bottle. That's not enough reason to risk your baby's dentition and their dental health and hygiene. That is not okay. There are other ways to teach the baby how to fall asleep without having a sugary liquid around their teeth. Now, some people say, but I thought milk was good for teeth. Well, sure, in the normal amounts, and if their teeth are brushed before they go to bed, sure, but never just lying in the bed with sugary fluids all around their teeth. And this would apply to milk is what we're talking about, but also juice, or certainly they need any sugary fluids, including juice. Now, the other reason that it's a problem to have prolonged bottle use, and I have seen this so many times through the years, is that the baby will often prefer to just drink their calories. And they drink so many calories from this milk that they're not hungry enough to eat their regular food. Well, you may realize this, but there's no iron in milk. And so the babies can become extremely dangerously anemic. Let me remind you, at this 12-month mark, when we want to completely discontinue bottle use and put all milk into a cup, now certainly they can breastfeed past that point, but even with breastfeeding, we don't want them just nursing constantly throughout the night because it's not good for their teeth and can cause cavities, and I've seen it happen. They can certainly be fed, but not just like I had a mom that told me the babe just latched on and just stayed on for 3 hours in a row with an occasional swallow with the milk just pulled all around her teeth and dripping out of her mouth. That is not healthy for dental hygiene or for the mom's amount of sleep. It turns out either this was a much older child. So the babies at 12 months, if they're on formula, are allowed to switch to whole milk. And it should be whole milk, by the way. It should not be skim 2%, almond milk, rice milk, all that. Nope, whole milk, because they need that good fat for normal brain development to myelinate their neurons as their brains are growing so rapidly at that point. Now, they only need, though, 16 to 20 ounces per day. When you exceed that, they get full of milk calories and won't eat solid foods. That can contribute to excessively picky toddlers. They can become very anemic. They can become very constipated. So we have to give up the bottle. And parents will say, but if I give up the bottle, they won't drink milk at all. Okay, we'll take it for a few weeks. They'll usually come back around. And if they consistently continue to refuse to take milk, then you can offer them cheese and yogurt and pudding and other calcium-rich products if they refuse. But most of them, after they are just after they get over being so ticked off at you taking the bottle away, then they'll realize they still like milk and they'll drink it out of their sippy cup, which is fine. So all babies should have their teeth brushed twice a day. We do recommend a fluoride-containing toothpaste. Be very careful what you listen to on the internet. Some of the recent studies saying fluoride was dangerous. We're talking about studies done in other countries, not in America. So we recommend a little smear of fluoride toothpaste once the first tooth erupts, and once, continue to brush twice a day, 2 whole minutes with that. They can't spit at first. That's why we say a smear. After 3 or older, when they can spit intentionally, you can use a pea-sized amount. So we're worried for prolonged bottle use because it's messing up their sleep. They're waking to get calories. It's causing tooth decay, severe tooth decay. It's filling them up with milk calories and they become anemic and they become constipated. There are a lot of reasons. We're not trying to be mean to take away their bottle, but you have to do it. Quit procrastinating this one thing. It is exceptionally important. I want to encourage you. I hope that helps.